Senator Hannon, thanks for joining us today.
Thank you.
I just want to ask you a few questions about healthcare, which is the topic of our spotlight this issue. First of all, the governor recently came out with his budget for the year, and there are a number of healthcare proposals in there. What was your reaction to the healthcare items in the budget?
Twofold. He focused on some of the things that need to be done to move the state's health care forward. We've already moved a great deal with the Medicaid redesign, changing the delivery of services, saving money, taking a new look at things. But the state has been saying to the federal government, we've saved you $17 billion, your portion. Let us have some of that back so we can continue to move forward, so we can continue to redesign what we have to do, deal with some of the more difficult populations in regard to their health, and then CMS, the federal agency that deals with this, has said recently to us, well, we don't know if we're going to say yes or no, very maddeningly. But they also said we won't allow you to do anything for capital or for information technology. So the governor has proposed, if we get the waiver, to do in conjunction with that our own bond issue, so we would get capital infrastructure and information technology. And that would not be, someone said to me recently, oh, you're just going to fill in and keep hospitals that are failing going. No, no, no. The rules would be you have to change what you're doing, change how you're doing. And in fact, the stated goal has been to cut hospital admissions by 25% in 5 years. That's a big change in the way things go, and it leads to other philosophical debates such as, do we keep every hospital open at any cost at any time?
Sure, and when the governor talked about that in his budget address, he had mentioned, I think, Texas and California, and
yes,
how their waivers were submitted and approved within 6 months, and it's been 18 months for New York. Do you have any sense of why it's taking longer for our state?
A couple of things. First of all, let me just point out that when the other states got waivers, their per capita amount of money they got in the waiver was pretty much along the lines of what New York has requested. So it's not as if we're being extravagant. Why would they take time with us? It may be our system is that much bigger and more complicated. Second, it is also we've run into a lot of whitewater because the state of New York, with federal approval and federal grants, have been getting a considerable amount of money for taking care of our developmentally disabled population. And in fact have been getting a little bit more than we'd actually spent, so we would go into the community and have services follow the individual. Well, there's some people in Congress, especially in the House of Representatives, that are a bit upset about that. So I'm speculating, but that may be part of the concern.
And you also mentioned just now the possibility of a bond issue for health. Would that be next year? I know this year the push is for an education.
It wasn't specified. It would be along the lines of or in conjunction with the waiver money, and so that would take a while to start up. So I don't know. I don't think it was immediate, but I'm still looking at the thousands of pages of the budget document to get the specifics of the proposal.
Now, you've also been scrutinizing the state's healthcare exchange as part of the federal healthcare reform. What is your thought on how that's being rolled out? Do there need to be any changes, or is it working pretty well?
Well, we had an oversight hearing with the chairman of the State Insurance Committee, Jim Seward, and the idea was not to be critical, not to poke holes or anything like that. In fact, we waited until after the whole Obamacare Act began, after the 1st of January 2014. And we really wanted to get a sense of where the exchange was going, how well they felt they were done, challenges they need to make. And we did that, and we had a number of the interested parties come forward. We had the insurance companies explaining how many of the applications they had received, and the notice of the applications, they were only received in their companies by about the middle of December. So to get them coverage within a couple of weeks was very difficult. But we did have patients and doctors talking about the confusion on who was in a given network, which doctors were in the network, which insurance companies were actually covering, because given a name of one company, it may mean one subsidiary or the other, and then whether they had the ability as a patient to go out of network. And so the whole concept, which some people have said, well, companies to get into the exchange had to reduce the amount of doctors or hospitals and how much they're paying them. And patients are saying, wait, we expected to have things the way they were. We expected to have our own doctor, keep our own doctor, if you will. So there is a considerable difference. My conclusion is it's really created by the federal law, and there's a considerable difference between expectation on the part of patients and reality in terms of delivery by doctors and hospitals.
And another buzzworthy healthcare issue out there is medical marijuana. It's something some lawmakers have pushed for. The governor has his own proposal for a very limited executive action. Where do you come down on that issue?
Well, I'm just going to go. If this is the governor's proposal, we'll be there. We'll let it go at that. There are other members of the Senate, Senator Savino, who's not complacent with that point of view, but at the moment the governor has been there, and he would have to be the one to do it. Indications are there's actually some hospitals that would be helpful along those lines, and I think that's a direction for the moment we'll go.
And are there any other key healthcare issues you're going to be prioritizing this session?
There's a considerable amount of healthcare issues. It begins and ends with just A to Z. We've started a task force on Lyme disease, because we want to look for an action plan by the state in terms of how do you prevent it, what we can do to foster research about it, what are appropriate treatment vehicles, what are insurance rules. It's just become very prevalent from the tip of Long Island, pretty much working its way west. We're now into at least Schoharie County, but the whole Hudson Valley is just rife with ticks. Number of other initiatives in regard to public health, number of initiatives on structure of the healthcare system, what are hospitals doing, and interestingly, a number of doctor delivery systems. There's been discussion of mini clinics in pharmacies. There's been discussion of what do you do or anything about urgent care centers, which are springing up all over. There's questions about should we have freestanding emergency rooms or even part-time freestanding emergency rooms. There's questions about the role of nurse practitioners. And it's all the delivery of service aimed at primary care. How do we keep track of who's been treated? What do we know about who's been vaccinated? So there's a lot of intermediate steps that need to be taken.
Should be an interesting year.
It's fascinating.
Well, thanks for joining us, Senator.
Thank you, John.